Greetings from the Dr. Tushar Choksi. Today's my topic is apothecary of an anesthesiologist. As you see the front slide, you can see the our OT storehouse of the drugs. And from the word, you can make out that apothecary means our storehouse of the drugs in the OT. So what is apothecary? Apothecary is a person who prepared and sold medicines and drugs. Apothecary derives from the ancient Greek word apoth. Apoth means storehouse. An example of an apothecary is a pharmacist or druggist. Modern apothecary is locally owned independent modern pharmacy. First apothecary history was in Baghdad, 754 AD by the scientist Jaber, the founder of chemistry science. And apothecary is one term for the medical professions who formulates and dispense to medicine to the physician, surgeon, and patients. And the modern apothecary specializes in providing you options for the high quality professional grades drugs and agent like anesthesiologist. We deal with the drugs, we prepare the combinations, we give the drugs according to patients' conditions and everything. So we are the apothecary of our OT. So apothecary of an anesthesiologist. We are an apothecary of our patients in OT and ICU. Now, what is the difference between pharmacist and anesthesiologist? Both pharmacist and anesthesiologist are the healthcare workers who administers medications to patients. However, pharmacists dispense the medications that have been prescribed by the physicians, while anesthesiologists are medical doctors who administer medications and provide other medical care to patients before, during, and after surgery. So we are dealing with the anesthetic drugs and their combination according to patient age, sex, disease, surgery with the time, space, and situation like pharmacist. Now, if you see that our anesthesia started in 1846, 16th October. So since last 200 years, how many drugs are invented in anesthesiology? So these are the main headings they are invented, like IV anesthetic agent, local anesthetic agent, volatile anesthetic agent, muscle relaxants, opioid anesthetic, benzodiazepine, pre-medications, anesthesia adjuvants and reversal, and antidotes, and gaseous agents. And these slides, you can see there are 68 drugs are invented in our armamentarium, and out of these 55 drugs are still we are using, and these now another 10 drugs are also we are using, but not regularly, but very occasionally, once in a year or once in a twice in a year, like that. So these are the drugs of apothecary in our OT, like propofol, ketamine, dexmedetomidine, beta blocker, all benzodiazepine, opioids, all muscle relaxants, lidocaine, clonidine, dexamethasone, magnesium sulfate, diclofenac sodium, paracetamol, volatile agents, and local anesthetics. We will take one by one very shortly. So what are the IV anesthetic agents? First is our propofol. See, according to propofol has changed the practice of anesthesia since last 30 years. It is a prime drug in all anesthesia procedure. Initially, anesthesia dose is 2 to 2.5 milligram per kilogram if used alone. And if you are using with TIVA, with any drugs, then it is 1 milligram per kilogram intravenous. And in infusion, it is 6 milligram per kilogram per hour for maintenance. And if you see that co-administration of propofol with remifentanil is the prime drug in all over the world in TCI, and it rules the world with the combinations. And in right side, there is a dose schedules of the propofol in TIVA dose and TCI dose. So there are 4, 6, 8, 10, 12, 14, and 16 like sedation, light pain, laryngeal mask, moderate pain, surgical anesthesia, intubation, and strong pain or deep anesthesia. Now I'm going to show you so many infographics in this my lecture, and this is regarding the propofol. Now propofol, I had said that the most widely used drugs in anesthesia, not a single anesthetic in the world. I don't find any single anesthetic in the world that they are not used in this propofol. It's a main drug in TIVA. Now we have seen that 10 ml, 20 ml, 50 ml bulbs are available. Now 1%, 2% bulb with MCT, LCT, and pre-filled syringes are available as a 10 ml and 20 ml. We called it as a milk of amnesia. It's a switch on and switch off anesthesia. It is also used in veterinary medicine for the anesthesia. It was invented in 1977, but it started in 89. When we were studying at that time, we have just heard that propofol is coming in the market. Now, second drug is ketamine. I will take very shortly all the drugs. Ketamine, I called it is a brahmastra for the anesthesiologist in anesthesia. It's a most popular drug for the anesthesiologist across the globe since last 15 years, 50 years. It is NMDA antagonist, key role and main drug in TIVA, based analgesic, amnesic, and opioid sparing effect. I use in my practice every day for each and every patient, whether it is for short GA or whether it is for the regional anesthesia as a sedation. But I use ketamine in my daily routines. So dose less than 0.5 milligram kilogram, 0.5 milligram per kilogram reduces post-operative analgesia, and it also very useful for the opioid tolerant patient. So it has anti-hyperalgesia and anti-tolerance effect. Now, hyperalgesia means tolerance to the narcotic. When it was withdrawn, then patient feels more pain when they are not taking the these narcotics. I will come with my story about hyperalgesia. So ketamine is only intravenous anesthetic with hypnotic, analgesic, and amnesic property. The intravenous administration for TIVA, it is 0.5 to 2 milligram per kilogram. The beauty of ketamine is that it can be mixed with all type of anesthetic and narcotic agents in single syringe, like ketamine with midazolam, ketomate, ketamine with propofol, ketofol, ketamine with dex, we called it ketodex or catdex, and either with etomidate also, we called it ketomidate, and one of the established drug for the TIVA mixtures. So ketamine now it is a WHO list of essential medicine, invented in 1962 and started practicing in 1970. Most popular drug in anesthesia. See, beauty of ketamine is that whatever the route is mentioned in pharmacopoeia, we can give ketamine through that route. Now, the latest in ketamine vaginal or ketamine rectal suppository and ketamine eye drops are under pipeline. Soon we will get that type of also preparation. My hyperalgesic story. Now, 1 month back on 18th of this September, I had gone through my spine surgery of L1, L2, and suddenly it was an acute disc prolapse. So I had to go for emergency operations. Post-operatively, my surgeon has advised for me Contramal 50 milligram TDS in dose, and for 1 week I had taken this Contramal. So when I went for the stitch removal, at that time, my neurosurgeon told me that you don't take now. If you don't get pain, then you don't get this this analgesic like this Contramal. So I have stopped ketamine and I started gabapentin. But surprisingly, I was getting excruciating pain for the another 2 days, and you won't believe that I was not able to sleep even. So I told my neurosurgeon that. He told me it is not happening every people, but I told him after cessation of after stopping this Contramal, I have got this type of the pain. So he told me, you start again this Contramal, but I was reluctant to say that. Then I thought that I should take my own preparation like Apothecary in our OT. So this mocha ice cube, I had taken these 2 ice cubes in the empty stomach, and surprisingly, I got relieved within the 1 dose of this mocha ice cube. That was my hyperalgesia. So what is mocha ice cube? It's a novel combination of oral premedication for pediatric patients, especially with the ketamine. So I called mocha is a mocha means midazolam, ondansetron, ketamine, and atropine. I combine all these drugs in and put in the freezer to form ice cubes. And 1 hour after oral premedications, all pediatric patients are calm, cool, quiet when I give to them at their empty stomachs. There is no crying, rowdiness, injection fear, or anxiety in both the patient as well as parents. I use this combination since last 5 years. And believe me, it's now used by so many pediatric department all over India. My third drug is Dexmedetomidine, most ideal AV anesthetic agent in our armamentarium. It is alpha-2 agonist. Dexmedetomidine has hypnotic, sedative, and analgesic properties and is estimated to be 7 to 10 times more potent than clonidine. Most ideal anesthetic agent. It has got opioid sparing effect. I told you Dexcat Ketodex combination is becoming very popular in pediatric TIVA and even opioid-free anesthesia. They may this patient when sedated this with dexmedetomidine, they are arousable, alert, and respond without any incomfortness. So they may quickly return to sedation again. So it is given conscious sedation or physiological sleep. Dose ranges from 0.5 to 1 microgram per kilogram, and maintenance infusion is generally initiated with 0.6 microgram to even 1 to 1.2 microgram per kilogram per hour and titrated to achieve desired anesthetic agent. Now, sublingual dexmedetomidine will be available in the few months. Already, sublingual dexmedetomidine is available in the veterinary anesthesia. So, dexmedetomidine is FDA approved in 1999. It was marketed in 2000, better than clonidine in all aspects, decrease the opioid requirement. You should understand that when you give dexmedetomidine, initially when you give, then it causes hypertension, then it causes hypotension, and it causes a biphasic bradycardia response, double effect. So always think bradycardia is more than hypotension. Those who are not using dexmedetomidine, I have prepared them for prayer. Dexmedetomidine prayer. What dexmedetomidine says to us? Hey buddies, I am Dexmedetomidine. My pet name is Dax. I am your complete friend to play with you in all games, IV, IM, oral, spinal, nasal. Even this dexmedetomidine is also given by all the routes. But my favorite game is intravenous with all stages, sedation, hypnosis, analgesia, anesthesia. I love to play with small babies to old age players. But during playing with me, be careful. I am very delicate and fall down with the weak players. I can also play in indoor stadium like ICU patient continuously for 48 hours. I'm always available to play with you and allowed me to play with others. Let us play and enjoy with me. Don't neglect me through I am new player. The one thing I want to tell you about this dexmedetomidine, I'm frequently using dexmedetomidine 15 to 20 microgram in my spinal anesthesia, and the spinal anesthesia effect is lasting longer than more than 6 hours. Fourth drug is etomidate. It is a very excellent cardiostable drug used mainly in hemodynamically compromised patient as an anesthesia induction agent. And I hardly use once or twice in month. For sedation, 0.1 milligram per kilogram, for TIVA 0.3 to 0.4 milligram, and for geriatric patient 0.2 milligram. Etomidate can be mixed with the ketamine. So most suitable mixture for short procedure. Best combination for rapid sequence intubation. Dose is 0.1 milligram per kilogram etomidate plus 1 milligram per kilogram is ketamine. And this etomidate causes this steroid suppression. So always give IV 100 to 200 milligram hydrocortisone before giving etomidate. And the rule is that first dose to be completed within 1 arm brain circulation within 60 to 90 seconds. Now opioids. In opioid, we don't have remifentanil in our country, and fentanyl, everybody has used fentanyl in their practice. So fentanyl is when we are using as an anesthetic agent. So bolus dose is 2 to 3 microgram per kilogram over 30 seconds, followed by 2 microgram per kilogram per hour for 30 minutes, then 1.5 microgram per kilogram per hour for 31 to 150 milligram, then subsequently 1 microgram. If you are using remifentanil, there it is available as a 1 milligram, 2 milligram, and 5 milligram IL. Initial dose is 1 microgram per kilogram, and TIVA maintenance is 0.25 to 0.5 microgram per kilogram per minute. And about fentanyl, fentanyl is a potent opioid agonist, and it is 100 times more potent than stronger than morphine. This morphine, after morphine, the epidemic of opioid anesthesia has started, and fentanyl is high potential for addiction. Fentanyl can be used with any drugs in the anesthesia, but the nausea and vomiting is more. Now, fentanyl patches are more frequently used for the cancer pain, and it is also a WHO list of essential medicine. It can be given by IM, in TIVA, in NORA, in rapid sequence intubation, continuous infusion, epidural, and with IV preparations. But careful with the fentanyl when you are giving with patients sometimes gets itching. This remifentanil. Remifentanil is also excellent drug after fentanyl, but one thing I want to tell you that hyperalgesia with narcotics, fentanyl is more frequently causes this hyperalgesia. It is more than even remifentanil. This remifentanil is a wonderful drug. It has changed the practice of TCI TIVA, and it is combined with the propofol in all over the world. Available as a 1 milligram, 2 milligram, 5 milligram. I told you, it is gives a conscious analgesia and even immediate post-operative analgesia, and it is always diluted. It is always to be diluted. It can be given. See, onset is within 1 to 3 minutes, and routes of administration is only IV, right? The if we are giving more, if the overdose is given, then the antidote is naloxone. It's a schedule 1 and 2 drugs like fentanyl, so it is not easily available without prescription. Remifentanil can be used in pregnancy, labor, lactation, geriatric, morbid obese patient. Now I'll come to adjuvant anesthesia drugs. First drug is midazolam. We are using midazolam since last 25 years, and now I have omitted midazolam from my practice. So regular dose is 0.05 milligram per kilogram. Co-administration of midazolam in TIVA reduces the induction dose and the total dose of any other anesthetic drug. But thumb rule is that total dose should not be exceed more than 10 milligram. This is midazolam infographics. So I will not go in detail with the midazolam. The midazolam antidote is flumazenil. I will come later on about the flumazenil. Here, if we are giving the IV, then it is 100% myobility. It is also available as a nasal preparation, syrup preparations. So for the pediatric patients, before giving anesthesia, it is very useful as a pre-medications. Now magnesium sulfate, one of the very favorite drug of mine. It is analgesic adjuvant, useful in patient receiving total intravenous anesthesia. It reduces the dose of propofol, dex, and atracurium, and very cost effective for the anesthesia. It is available at a 2 ml ampule with 500 milligram per ml and total 1 gram. It is only 10 rupees per ampule. Believe me, it has got a 32 effects in the anesthesia. Like I call it is a intravenous oxygen for the anesthesiologist. It is antihypertensive, bronchodilator, and antiarrhythmic, analgesic, anti-seizures, anti-shivering, anesthetic, adjuvant, antacids, and mild sedatives. So this magnesium sulfate, it is very useful in our day-to-day practice of anesthesia, and it is our prime drug in apothecary in our OT. That is why I called it is a intravenous oxygen. Like other drug is dexamethasone. I call dexamethasone is a universal weapon. You know, dexamethasone is used widely in anesthesia as an adjuvant. Before 10 years, I was not giving dexamethasone regularly, but now I am giving dexamethasone even in my short cases, even my spinal cases, and any case whenever I am giving anesthesia. It is anti-inflammatory and prevents and treats post-operative nausea, vomiting, suppress the inflammation, good analgesic. It provides a sense of well-being. Your patients will come out very nicely. It's a good quality of recovery. And single prophylactic dose, believe me, it does not, single dose is 8 milligram per kilogram, or 8 milligram can be given irrespective of the SXA disease. And one dose is never increase any sugar level in your body. So it is antiemetic, anti-nauseatic, anti-inflammatory, analgesic, anti-shivering, increased quality of recovery, and there is no effect on sepsis and sugar in single dose. This is dexamethasone infographics. Usually we are giving 8 milligram, so safe in oncoanesthesia, but avoid in psychiatric patient. It improves the cognitive functions in the elderly patients, but be careful in immunocompromised patients like liver transplant or heart transplant patient or any transplant patient coming for the anesthesia. Even it has got a weak antipyretic effect. Third drug is my lidocaine in my as a adjuvants. It is I called it is a best companion of the anesthesiologist, universal friend, magic drug. Analgesic, it has got analgesic, anti-hyperalgesic, anti-inflammatory. It reduces the opioid analgesic consumption. It has got an antiarrhythmic, improvement in patient's outcome, decrease aerosol droplets and during extubation. So this is about the intravenous lidocaine. Lidocaine is a very versatile drug. I give even it at the time of reversal also. Now, another best drug for the adjuvant in my anesthesia practice is paracetamol and diclofenac sodium. Paracetamol is a preemptive analgesic, has got opioid sparing effect. Loading dose is 30 to 50 milligram per kilogram and maximum not to be exceed 2 gram. Very innocent drugs. Each and every patient should get the paracetamol every 6 to 12 hours. An excellent adjuvant in pediatric anesthesia. Second, my NSAIDs is diclofenac sodium, powerful NSAIDs. Best is given in a single dose. But remember that the dose is not 1 milligram per kilogram. It is 1.5 milligram per kilogram. And use aqueous solution. If you are giving directly in the intravenous, then dilute it. But be cautious with renal, hepatic, pulmonary, and heart failure patient. The thumb rule is always give both drugs before surgical incision to inhibit prostaglandin receptors. So this is IV paracetamol infographics, and this is diclofenac sodium infographics. My one of the favorite drug is Esmolol in my Apothecary. That is, I called it is an emergency friend of anesthesiologist. Now it is not for emergency friend. I use it as a companion friend. I use in each and every patients of laparoscopic surgery because it is highly beta-1 selective. Esmolol appears to be safe in patient with pulmonary disease. It has got a central analgesic effect, and it decreases the anesthetic analgesic requirement, and it has got shown to improve postoperative pain and reduce opioid requirement. So this is Esmolol infographics. Some newer drugs came in the market and occasionally used drugs. First is Midazolam. Midazolam is just recently introduced narcotic. It has got a benzodiazepine with opioid properties. So effect is like benzodiazepine, but metabolism is like like narcotics. And it was invented in Japan in 2020. The name is Anirem. In USA, it is called Bifevo. In China, it is called Ruima. In Europe, Canada, South Korea, it is given Eptimida. It can be mixed with any other drugs in the fluid in the theater. But remember, it is available as a 20 milligram one bulb, and the price in USA it is $25, and in India 1800 rupees per vial. Most ideal sedative drugs. I think it will also change the anesthesia practice after propofol. Like propofol is 25 years before propofol has changed the practice, and within 10 years this Midazolam will change again the practice of anesthesia. Very safe drug, very safe drug. And you believe me, these drugs will be available even just now. Even FENTANYL is not available. Then we have a dream that Midazolam also should be available in short span in our India. One drug, Sugammadex, it's a reversal agent. The Sugammadex is it is purely selective reversal agent for the rocuronium and vecuronium for the muscle relaxation. Sugammadex is also very costly drug. It is around 25,000 rupees of one bulb. Sugammadex provides the rapid and dose-dependent reversal of the neuromuscular blockade. And here, remember, when we are using this co-administration of this glycopyrrolate and atropine with neostigmine, that is not required with this Sugammadex because it has got a co-administration of antimuscarinic if is not needed. Right? The dose is 0.6 milligram per kilogram to 1 milligram per kilogram. And especially we are using for the rocuronium, and it has got a weak vecuronium reversal effect also. Third drug is Cisatracurium. Cisatracurium now freely available, but 1 year before it was very nightmare for all the anesthetists. Now it is easily available from the prime pharmaceutical company in India. It is one of the 10 isomer of the parent molecule like atracurium. It is the most ideal neuromuscular blocking agent. Based intubating condition, non-depolarizing muscle mechanism of action, rapid onset, rapid, complete and predictable recovery, no histamine release. It is the main effect. No histamine release like other neuromuscular blocking agent. It has got a pharmacology inactive metabolism, and it has got a metabolism through Hoffman reaction, and it is very longer acting than atracurium. Less likely like clinical important cardiovascular side effect. So CIS gives the uniform recovery from anesthesia. Now in my practice, I have switched over from atracurium to cisatracurium, and it can be given in any condition of, even in cardiac compromised patient, ARDS patient, hepatic failure patient, renal failure patients, ideal in neurosurgical patients and chemo and obese patients. Flumazenil, it is a benzodiazepine reversal. So it is, I have never used it. It is available through one of the parent company of India, and it is freely available now, but it is very costly. Second is dantrolene. Dantrolene is an antidote of malignant hyperthermia agent. It is used occasionally by any anesthetist. It is very even I have not come across to use for this agent. It is recommended that each hospital should keep a minimum stock of 36 dantrolene vials, sufficient for the maximum 4 doses in 70 kilogram person. But you believe every hospital is not fortunate to keep this dantrolene, because dantrolene 20 milligram vial cost is 6,000 rupees and 36 vial cost around 2,16,000, and the expiry date is only for 2 years. So now how it works? Dantrolene is a post-synaptic muscle relaxant that lessens the excitation, contraction, coupling in the muscle. So it works directly on the ryanodine receptor to prevent the release of calcium, which causes the high-grade fever in our body. Third thing is Xenon, one of the best drugs available in the world. Xenon is labeled as the most perfect and ideal anesthetic agent, even better than, even faster induction than sevoflurane and propofol. And emergency is also 2 to 3 times. It is called as the anesthetic of the future, but it is very costly. For 1 hour of the drug cost is around 15,000 rupees in closed circuit. So I think in this life, I will not able to use this Xenon in my practice. It is colorless, odorless, non-pungent, non-toxic, non-explosive type of this gas. It is similar to nitrous oxide, but how it differs? Xenon is 1.5 times more potent than N2O. Xenon is 200 times costlier than N2O. Xenon also produces euphoria like N2O. Xenon oxygen ratio is N2 80-20. Like N2O, we know that it is 66.33, 66-33. Xenon rarely causes diffusion hypoxia. There is no antagonist like Xenon, no antagonist for Xenon anesthesia. Like N2O has got an naloxone. And practically and virtually, there is no side effect of Xenon. So it is labeled as a most perfect and ideal anesthetic agent. Other oliceridine, new synthetic opioid, approved in August 2020 by FDA. It's a mu opioid receptors, very good analgesic effect with very few side effects. Only available in USA, indicated for short-term IV use during inpatient and outpatient procedure. Contraindicated in respiratory depression or acute or chronic asthma. Second is gentacurium. It is new experimental neuromuscular blocking drug. It is currently undergoing phase 3 clinical trial. It was introduced in 1999, approved by FDA, but within 2 years, because of its side effect like histamine release, hypotension, reflex tachycardia, and continuous flushing, it was withdrawn. Its half-life is 26 minutes like atracurium. Gentacurium is not available for widespread clinical use. Second thing is liposomal bupivacaine, one of the best drugs available in all over world, approved by the US FDA in October 2011. It is like it is like a propofol. It is a milky white solution. The maximum dose is FDA approved dosage of liposomal bupivacaine is 260 milligram, 266 milligram. Liposomal bupivacaine is extended release of the bupivacaine that may last as long as 3 days after a single infiltration. It is approved for the single dose wound infiltration in postoperative pain relief. Should not be used with the lidocaine or other non-bupivacaine local anesthetics. But believe me, the one bulb cost of 20 ml 260 milligram, 266 milligram is 25,000 rupees. Where it is used? That is FDA approved. Hemorrhoidectomy, bunionectomy, transverse abdominis plain block, mammoplasty, total knee replacement, arthroplasty, local infiltration. But off-label use is peripheral nerve blocks, arthroplasty, intra-articular use, and intercostal nerve block. If you want to ask about this in India, then the person Neeraj Nagpal is exporting this drug, and this phone number is for him. you can contact him and get the Exparel, that is a brand name of this bupivacaine. Another come in market is Heptiva and Duzitol. Heptiva is an anesthetic plus narcotic combination, combines the pharmacodynamics of propofol with the pharmacokinetics of remifentanil, and Duzitol is an anesthetic plus narcotic plus muscle relaxant and combines the hypnosis, amnesia, analgesia, and muscle relaxation. Apothecary drug combinations. What to understand before mixing any drugs of anesthesia? Anesthesia triangle, the concept of anesthesia triangle we studied in our MD anesthesia program. It has got a hypnosis, analgesia, and relaxation. And whatever the drugs enters in this prism, they have got a pharmaceutical, pharmacokinetics, thermodynamics, and thermodynamics mechanism. So this is the very beautiful chart given in Columbian Journal, which drugs can be combined with which drugs. So all drugs is green is compatible, red is not compatible, white is not tested, and yellow is non-conclusive. I have developed one apothecary kingdom. Here, anesthesiologist is king or queen, and they have got a prince, propofol, ketamine, dex, first and second supreme commander, then fentanyl and remifentanil commanders, and others are soldiers like magic, universal, base soldiers, emergency. Whenever you give anesthesia, there here anesthesiologist, the king will decide their military in battle of anesthesia, whom to send alone or in combination. And for anesthesia induction, prince is the most common warrior. We give propofol for induction. And anesthesia maintenance, prince with one or two supreme commander like ketamine or dex, and other commanders like fentanyl, remifentanil, we are giving for the induction. And these are the best military of the king. And for pediatric anesthesia, in absence or presence of prince, two supreme commander go to with the small battle. Different combination of drug, that is KPD, ketofol, ketodex or dexket, FP or RP, PDF, MDF, ketomid. So this is ketofol, ketamine 1 milligram and propofol 1 milligram combination, ketodex 1 milligram and dex 1 microgram, ketomid 0.1 milligram midazolam, microgram per kilogram midazolam, and 1 milligram per kilogram this ketamine. Ketoetomidate is very a combination ideal for the cardiac compromised patient. Third is my favorite is KPD anesthesia. I mix it 1 milligram, 1 milligram, 1 milligram, 1 milligram, and 1 microgram in mixture. I give it for the maintenance and even for the induction. The advantage is low dose of each agent compared to other full dose. It gives low dose of individual, decrease airway complications, stable hemodynamics, and rapid recovery. Propofol fentanyl combination. This combination is showed no significant degradation of the emulsion within 24 hours, but the propofol reduction is by 50%. We will decide in our apothecary which drug should be mixed with which drugs for which patient. And this is RP anesthesia, very most widely used TIVA combination with TCI in the world, and that can be mixed in the polypropylene syringe in one syringe. It's an ideal agent for the TCI. Different methods of anesthesia, that is GA, SA, epidural, volatile induction and maintenance, TIVA, RA, block anesthesia, general anesthesia with regional anesthesia with general anesthesia, combined intravenous volatile anesthesia, multimodal analgesia, local anesthesia, TCI target control anesthesia, closed loop anesthesia, combined spinal epidural, veterinary anesthesia. This is total intravenous sets are available in the world. And this is the TCI. We have seen one syringe TCI. This is double syringe and 3 syringe TCI. In this 3 syringe TCI, you can read that propofol, fentanyl, remifentanil, and vecuronium can be given simultaneously through the one line only and with the one computer. And this is a closed loop anesthesia where the computer is in between, and this output is monitors and input is drugs. And from the monitor, from input means output, this monitor will decide the dose of the drug through the computer. So these are the closed loop anesthesia. This is a vicious cycle. According to parameters, the drugs will be at the right time with the right patient at the right way, and right drug will be injected. This is all in one TCI CLA, like Swiss knife, both in one unit. This is Asina pump and play. If you are bored with your this TCI machine, you can have a joysticks. You can play on your this TCI pump. And these are the different types of vaporizer available in the world, and they are variable bypass vaporizer. We are using frequently in our anesthesia workstation. but this is plenum vaporizer with electronic control. And these are the measured flow vaporizer for only for the desflurane. And this is the direct injection of volatile anesthetic vaporizer. So I dream for this, my future apothecary is that the anesthesia machine will be in one unit. We have got a different IV anesthesia drugs in one unit, gases in one unit, volatile agents in one unit, and everything in one monitor. And we can have a switch on, switch off anesthesia of apothecary of one anesthesia workstation. If you are bored in your theater, then we can choose chess with your apothecary drugs. So my take home message is step into your comfort zone of apothecary for all anesthetic drugs with end result of safe anesthesia, safe surgery, safe patients, and safe yourself. Join with us with Facebook group like TIVA and SOFA, opioid free anesthesia. Thank you.